Philadelphia chromosome-like or PH-like ALL is a specific subtype of B-cell acute lymphoblastic leukemia that was identified just within the past decade or so. It's often confused with Philadelphia chromosome-positive ALL because the names are very similar. However, PH-like ALL, although it does have many features that are similar to PH-positive ALL, doesn't have the same chromosome changes. And specifically, PH-like ALL does not have the same BCR-ABL fusion that we see in PH-positive ALL. This newer PH-like subtype of ALL is actually fairly common and is present in about 10 to 15% of children and around a fourth or more of adults with B-cell ALL. But one of the challenges is that PH-like ALL is not detected with our typical standard evaluation for ALL, and therefore it's often missed at diagnosis. It used to be that the test for PH-like ALL could only be done at very specialized centers. But luckily now, many of the tests that can identify this PH-like ALL subtype are becoming more widely available and can actually be sent by most physicians. The reason that it's so important to identify PH-like ALL is that historically, this subtype of ALL has poor outcomes. But now we have some newer approaches that are investigating whether adding different targeted treatments can improve survival. For instance, for some subtypes of PH-like ALL, particularly the ones that are more common in children, we believe that perhaps adding the same medications that we use for PH-positive ALL, such as dasatinib and imatinib, may be beneficial. With some of the other subtypes of PH-like ALL, in particular the ones that are more common in adults, we and others are performing clinical trials to see if adding other medications to target these subtypes can be helpful. We also think that for some patients with PH-like ALL, stem cell transplant should be considered because there's a very high risk for the disease to come back, even with a good response to treatment. And so I think it's important to know that this PH-like ALL is an important subtype of ALL that can easily be missed at diagnosis if not appropriately evaluated. But it should be kept in mind, especially as we come up with newer treatment approaches and these become more widely available.